over the list of medications that you provided for the nurse and everything that was in your chart. Before we kind of go over those medications and addressing the chest pain that you came in having, are you taking any additional medications at home, whether it's over the counter, herbals, or supplements?
Yes, I'm taking a medication for the acid reflux. I think it's called omeprazole.
Okay.
And for my back pain, I'm taking ibuprofen. Oh, and I started taking a potassium pill recently.
Okay. Yeah, so we're definitely going to have to go over some of those because we are going to have you stop and switch some of them, okay?
But why am I taking all these medications? I feel like I have so many medications.
I know it's a lot of medications and it does seem like a lot, but with your history of the heart attack and the heart disease, along with the stenting that they just placed, we want to make sure that you're making sure that you're continuing a lot of these medications for preventing additional heart attacks or strokes or anything else. So I'm going to go over the medications. We'll talk about why you're taking each one individually and kind of go from there, okay? So the first medication on the list is the lisinopril. So the lisinopril essentially is a blood pressure medication. It works essentially to help relax and widen those blood vessels, which is going to help with, along with the other medications you're taking, like the metoprolol and the isosorbide dinitrate. Those in combination can help with the chest pain that you're feeling, but also reduce the big one is going to be a reduction in the blood pressure. So by bringing down your blood pressure, if you have high blood pressure, it will help with the chest pain. The second medication, the metoprolol. So it works very similarly. It works directly on the heart and the vessels to help both slow the heart rate, so it helps to increase that contractility or the way the heart works, and relaxing those muscles as well, or the blood vessels, to make sure that that blood flow is able to flow throughout your body, but also come back to the heart very well. So it increases the blood flow. The third medication, the isosorbide dinitrate. So that one is, we use it a lot in patients that are having chest pain, or in medical terms, we call it angina. That chest pain will be due because of that coronary artery disease that you have, so those blockages that you've had. It will help to reduce that chest pain and also reduce the mortality rates or the complications that you'll have after a heart attack. It works very similarly to the lisinopril and the metoprolol, where it does help to relax the blood flow, the vessels or the smooth muscles, those vessels, and it allows that blood flow to come back to the heart, and it allows the oxygen to reach the heart. So if there's not enough oxygen reaching the heart, that's when we start having chest pain, and in turn we can have some of that muscle die. So the metoprolol, the lisinopril, and the isosorbide dinitrate help directly with the chest pain because of the relaxation of those vessels. The other medication that you're on that will also help is the spironolactone. So that one works a little bit differently. It is essentially a blood pressure medication, but it works by allowing your body to pee out that extra water and that sodium. So water and sodium together, they can increase your blood pressure. So by peeing out that extra water and sodium, you're essentially helping to bring down your blood pressure again. This medication, though, instead of peeing out also potassium, which comes out through the urine, it also will help to maintain or retain that potassium. So you're not going to be peeing out that potassium, which is a big issue in some of our other, what we call diuretics, those medications that help you pee. So I know you told me that you were taking a potassium pill as well. Is that correct?
Yes.
Okay, so I'm going to actually have you stop taking that potassium pill. The reason being because if you're taking this medication, it's keeping in and storing that extra potassium. You're not peeing it out the way you normally would. So by taking that potassium pill, you are running the risk of increasing your body's level of potassium, which can lead to further heart issues. It can cause your heart to kind of contract a little funny, and it can cause arrhythmias, meaning, again, the rhythm is off. So we're going to stop taking the potassium pill, the supplements, altogether, and then we'll, when we do some blood draws, we'll make sure that we're checking your potassium levels as well. The next two medications that are going to be kind of going hand in hand, I'm going to go over is the clopidogrel and the warfarin. So the clopidogrel works a little bit it's an antiplatelet medication. So that antiplatelet medication essentially, it keeps the platelets, or those little round discs in your blood that help to clot, it keeps them from clotting. So by doing that, it's essentially keeping those clots from forming in your body, which can lead to additional stroke, heart attack. But our main concern is that stent that you had placed in your heart. Because of that stent, you are at risk for sometimes those platelets to stick to that stent and cause a clot in the heart, which will cause another heart attack. The other one that we are on is the warfarin. So that one works a little different. Instead of being antiplatelet, it's an anticoagulant. And essentially, it kind of works the same, but this one's like, it keeps your blood from clotting. So it's a blood thinner. So it works very closely with vitamin K. It works against the vitamin K enzyme. It's an enzyme in your body. When activated, it helps clots form. So warfarin works against that. So because of it working against vitamin K, we want to be careful with intaking a lot of vitamin K. Vitamin K is found very commonly or primarily a lot in leafy greens. So if you're changing your diet, you're trying to eat a little bit healthier after the heart attack, and you're increasing your levels of leafy greens, salads, things that are high in vitamin K, we want to make sure that you're letting us know so that way we can do some more blood levels. We check that warfarin is working okay by checking something in your blood. It's called INR. It's essentially showing us how effective that medication is. If you're intaking a lot of leafy greens, we're going to want to take another blood level, and if it's not effective, we will increase your dose of warfarin. But we want to make sure that your intake of that vitamin K is pretty much the same throughout. You don't want to all of a sudden start taking a lot of vitamin K, a lot of those leafy greens, and then all of a sudden you stop taking them after we adjust the medication, because you can be at risk for bleeding. So those again will help to keep your blood from clotting and keep from forming any clots on that stent or strokes and heart attacks. Okay. The medication that I do want to change is the simvastatin. I know you were taking simvastatin previously, but we're going to be changing it to atorvastatin, or another name that we sometimes go by is Lipitor. You're going to be taking it, it's going to be 40 milligrams. It's a little bit increased from the simvastatin. It's only going to be 1 pill a day, so daily. The reason we're going to be changing this is because due to your history of the heart attack and the stenting, you are now at higher risk for repeat cardiovascular events, heart attacks, strokes, anything like that. The atorvastatin is a little bit more of an aggressive cholesterol medication. So the simvastatin is also a cholesterol medication. They're in the same family, but atorvastatin has shown to be a little bit more effective at preventing, follow-up cardiovascular events by lowering that cholesterol. So it works a little bit harder than the simvastatin does, okay? The two medications that I know that were on the list that you kind of went over with me and told me that you are taking, that I'm going to have you change or stop taking, number one is the omeprazole. I know sometimes we have that GERD. I'm going to give you a prescription for a medication called Protonix or pantoprazole. It works a little bit differently. The reason that I'm changing it, I know the omeprazole is over the counter, but the pantoprazole, the reason is because the omeprazole actually works against the clopidogrel and the warfarin. So those coupled together, it reduces the effectiveness of the anticoagulant and the antiplatelet, so it'll increase your risk of clotting. So we're going to stop the omeprazole, start taking Protonix, okay? The last one that I wanted to go over with you, I know you also said that you've been having some back pain and you've been taking ibuprofen. Ibuprofen has been shown to have an increased risk of causing cardiovascular events such as heart attack and stroke, and also bleeding, especially in patients over 65. Since you are over 65, you are at an increased risk of gastric ulcers with this medication, heart attack and stroke. And since you're already taking the warfarin and the clopidogrel, both of those are going to already increase your risk of bleeding, but coupled with the ibuprofen, which is going to cause ulcers, you might experience some like stomach bleeding or GI bleeding, which we don't want. Okay. Do you have any questions about some of the medication that we went over? No? The last thing I'm going to mention, so I know that the medications that I first mentioned kind of, we went over that they do help with chest pain. They help with chest pain that's associated with that coronary vascular artery disease, but they don't act immediately on them. So if you're having some sudden onset of chest pain, I am going to ask you to make sure that you make an appointment with your cardiologist. If you start experiencing any symptoms on top of just the occasional chest pain, like chest pain that's not going away, or very strong chest pain that's all of a sudden making it hard for you to breathe, you're having some shortness of breath or some swelling in the lower extremities, I will ask you to go to the emergency department instead of waiting for your cardiologist. So as soon as you can, please go see your cardiologist. They'll probably end up doing some heart exams, such as an EKG or an echo, just to see how your heart is working, to see if they need to do anything additional, or if they need to change any of those cardiac medications. Okay?
Thank you. I'll call to make an appointment today with my cardiologist.
Okay. If you don't have any more questions, I'm going to be leaving that prescription. I'll be coming back with the prescription. I'll send it over to your pharmacy, and like I said, I'll leave some notes. Please make sure that we're stopping that ibuprofen, that omeprazole, and we're not taking any potassium supplements. Okay. I'll also ask you to take some lab draws before you leave, just to make sure everything is okay, as far as like your INR for the warfarin, your vitamin K, everything else is okay. If you don't have any questions, I'll be back in with the prescription, and then you should be good to go. Okay.